Hi friends, in this video I would like to discuss about iliotibial band syndrome. Clinical presentation is pain over lateral femoral condyle in between age group 15 to 25 with history of repeated running either along the flat surface or in a horizontally banked surface. Repeated cycling, walking over horizontally banked surface also causes iliotibial band syndrome. Actually, it's a repeated strain injury. The site of pain is 2 centimeter proximal to lateral joint line. For locating lateral joint line is just lateral to patellar tendon. Patellar tendon is connecting patella and tibial tuberosity, and on 90-degree flexed knee joint, just lateral to patellar tendon in between lateral femoral condyle and lateral tibial condyle is lateral joint line. 2 centimeter proximal to lateral joint line is the pain present in iliotibial band syndrome. That is the typical point of pain. 2 centimeter proximal to lateral joint line in the lateral femoral condyle. The patient who is having iliotibial band syndrome is presenting pain. The iliotibial band actually runs along the lateral thigh. It's in between tensor fasciae lata and gluteus maximus, and it runs along the lateral thigh and it is attaching on the lateral tibial condyle. But the point of friction on repeated flexion and extension of knee joint is over lateral femoral condyle in which 2 centimeter proximal to lateral joint line. Repeated flexion and extension of knee joint cause friction of iliotibial band over lateral femoral condyle. This is the area of pain, but its attachment is on the tibia. Clinical examination includes Rennie's test and Noble test. In Rennie's test, ask the patient to stand on the affected leg and flex the knee up to 30 degree. Up to the flexion of 30 degree itself, patient felt pain over the lateral femoral condyle. In Noble test, hold the lateral femoral condyle with your thumb, with examiner's thumb, and ask the patient to repeated flexion and extension of knee joint, which causes pain over the iliotibial band. Here you can see the video first of Rennie's test. Ask the patient to stand on affected leg and then flexion of knee joint. Patient felt pain over lateral femoral condyle. Here hold the lateral femoral condyle with thumb, and then ask the patient to do repeated flexion and extension. This is Noble test. By this clinical examination, we can diagnose iliotibial band syndrome. A patellar strap is very effective in iliotibial band syndrome only in the beginning phase if the patient needs to continue sports activities. Otherwise, no need of this strap, and continuous usage of strap is not advisable as it causes wasting of muscles. Here we can see a video of modified srunga for quick relief. As the patient needs to continue sports activities within 1 week, then make a suction over the most affected tender point, then do pricking with a number 12 blade attached to BP handle like this. Then again continue the suction. 2 to 5 ml blood is taken out by this particular procedure. Patient felt immediate relief after the procedure. Surely ask the patient to continue rehabilitation from the very next day after the procedure. This is modified srunga. First, we apply a suction over the most tender point. Then, using a number 12 blade attached to BP handle, we prick over the particular site, and then again apply the suction. By this, we can able to taken out 2 to 5 ml of blood from that particular area, which improves the circulation to that particular area, which gives good relief. This is a procedure called modified srunga, which is very effective in the iliotibial band syndrome. This is another procedure, agnikarma. The area should be clean. Then using a blowtorch, agnikarma shalaga is made to red hot. Here you can see using a blowtorch, agnikarma shalaga is made to red hot. Here the treatment protocol is Snava Sandhi Siraprapti Snehadaho Banahana. Snava Sandhi Siraprapti Snehadaho Banahana. First, we can do Upanaha. Then, second, for Upanaha, you can use either cotton chukadi or ellu nishadi, Labachurna. Then, agnikarma, and at the end, Taila Prayoga internally. If there is Pitta Goba, then modified srunga is good. If there is no Pitta Goba, then agnikarma is very effective. This is the difference of modified srunga and agnikarma. Don't do agnikarma in Pitta Pragopa condition. Agnikarma is to be done on the most tender point, 2 cm proximal to lateral femoral condyle. 6 to 9 spots should be done like this. Luksha agnikarma is done, and after agnikarma, a simple bandage for 1 day is advisable to avoid secondary infections. These rehabilitation are very effective in iliotibial band syndrome. To avoid recurrence, the patient should be advised with this rehabilitation. First one is heel raise. Ask the patient to stand on toe and raise heel. No need of hold. Repeat it for 10 times. This exercise is calf stretch. In this particular exercise, hold is needed for 5 seconds and repeat it for 10 or 20 times. Affected leg is kept on the posterior side. This is side leg lift or Anandasana. This is very effective exercise for iliotibial band syndrome. Hold is needed. Hold for 5 seconds and repeat into 10. If the patient is a sports person in between 15 and 25, then 3 steps Anandasana or 3 steps side leg lift is advisable. Raise the leg to just 20 degree, hold it there for 5 seconds, then raise it to 45 degree, hold it there for 5 seconds, then reduce it to again 20 degree, hold it for 5 seconds, and then repeat it 10 times. This is another exercise. For a small step is kept and the patient should stand up and down the step in a sideways position. In a sideways position for iliotibial band syndrome like this. These exercises are advisable for iliotibial band syndrome before starting the sports activities. And after the initial Amapajana, rehabilitation should be started. Second thing, internal Sneha Prayoga is must to avoid recurrence. And the third thing, agnikarma and modified srunga is not needed in all cases. If the patient needs quick recovery, immediately to start sports activities from the very next week of consultation, then you shall add such procedures, Anushastra Prayogas, which is very effective, which gives quick relief, and it is very effective in avoiding recurrence also. In agnikarma and modified srunga, both are effective to avoid recurrence, but rehabilitation is a must in both the conditions. For iliotibial band syndrome, please note the most common tender point, most important tender point is 2 cm proximal to lateral joint line in the lateral femoral condyle. Then it can be confirmed by doing Rennie's test. Only clinical examination is needed for the diagnosis of iliotibial band syndrome. Rennie's test is ask the patient to stand on the affected leg and then flex up to 30 degree. There will be pain on the affected side. Then, if needed, you can opt for Anushastra. Otherwise, Amashofahara management and rehabilitation, internal Sneha Prayoga gives good result in iliotibial band syndrome. Don't miss the condition as it is a very common condition. Thank you.